All right. Good evening, everyone. Good evening, viewers. Welcome once again to a Q&A session brought to us by Complete Care. So the topic of today's Q&A session is sexually transmitted diseases, what you don't know can actually hurt you. So for a lot of people, they don't know. Sometimes they feel, okay, no, I'm a virgin, or we can't get STDs because we are virgin, or because, oh, I have just a partner, a sexual partner. I don't have multiple partners. They believe, oh, I cannot have STDs. So this all leads to the fact that what we don't actually know can hurt us. So we are here today to educate us on sexually transmitted diseases, and actually to let us know more about it, to let us know that even if you have just a single partner, you can still contact it. Even if you are a virgin, you can still contact some of the sexually transmitted diseases. That is why they are called diseases. We have a lot of them. So we have here today with us on this session, our guest for today, we have Dr. Mopelola Olusanya. Welcome, ma. Thank you for joining us.
Thank you very much, and thank you for having me. Yes, our discussion today is on sexually transmitted diseases. And we just want to know, what are sexually transmitted diseases? We call them STDs. They are infections which could be bacterial in origin, it could be viral in origin, or it could be caused by parasites. And they are transmitted through sexual intercourse. But in modern days, not just vaginal intercourse, we can as well talk about anal and oral sex for those that believe in such. So it could be transmitted. But then, what are these diseases? We hear people, talking about gonorrhea, gonococcus. We hear all these herbal drug dealers talking about STDs. But then, what are they? For example, we have gonorrhea, and we have chlamydia, we have syphilis, we have HIV/AIDS, as well as AIDS, or the human papilloma virus, which you call HPV. So these sexually transmitted diseases, they have a peculiar way they present. For women, they might not quickly notice it, but the men, they notice it because of their anatomy, their body makeup. And most times you have unusual discharge or itching. By the time it gets to this point, that means there's real infection, because it takes time for infection to set up. Some people have resistance to infection to some extent, and others don't have. But the truth of the matter is, by the time you get to perceive an unusual odor, then you know that there's an infection in the reproductive tract where the STDs usually attack. At times they come like sores, especially for gonorrhea and chlamydia. They come as sores and blisters. They will just appear. They may appear painless at first, but with time you begin to notice that it's painful. And on urination, that's when you want to pass urine, which we call micturition. You begin to have pain. We call it dysuria, painful urination. These are some of the signs you will notice with STDs. Another important sign is just that somebody will be feeling feverish. Just you think it's malaria. No, because there's an inflammatory process going on. There's infection in the body. So the body will react by having fever. And not only that, at times they present as rashes. They just appear, at times they disappear and reappear again. And you notice a kind of painful, painful sex, especially the vaginal sex. You begin to have what we call dyspareunia. It's painful, and because of the infection. Now, the irony about STD is that there are a lot of maths that goes about it. People believe different things about STDs. One of it is, they said, no, it has to be cured by herbal medication. And that's why they'll tell you only one drug can cure all the diseases. This is not true, because most times you have to investigate the exact type of sexual transmitted disease before you can conclude. And this is done through laboratory investigation. We want to actually look at the microorganism that is responsible. Then we know what it is, and then we can treat with either antibiotics or we treat with antiviral drug. And this will have to be prescribed by a doctor, a physician, so that you don't just go to over the counter and say, no, I had sex, unprotected sex, or maybe I guess, or I'm seeing unusual discharge, I'm having painful sex, I'm having painful urination. You just go to the chemist and get Lincocin. That's the common one people abuse. Or get Bicham Ampiclox. That will not do anything because you have not investigated yourself. And the other drug you are taking, you don't know the content. So you have to be sure so that you are properly treated, and then you don't stand the risk of reoccurrence, which can actually damage the reproductive system and cause problems like infertility or delay in getting pregnant for either a woman or the man will be affected as well. Another areas that people look at is that they just look at people's face because he has lost weight and say this one has STD, especially maybe HIV. It's not like that, because you have other diseases like chronic kidney disease that can make somebody emaciated. The person will lose weight, or even liver disease, or even cancer of the lungs. People can lose weight for many reasons. So you don't just see people physically and conclude they have STD. They say, I see your friend. It's like you don't catch this thing. It's not correct because you are not sure. The another one that can actually cause a problem is when one is a bit promiscuous, there's no personal hygiene, no proper disposal of waste, and you are sharing needles, maybe with somebody that is an addict. One can actually, especially with addicts, they are fond of, I think, anal sex, and they can actually transmit infections like hepatitis and even other STDs, as we have mentioned. At times, sharing of barbing tools, all these things we use on our hair that are metals. If there's a wound, it's through the blood, so it can be transmitted. Not only that, on sterile needle, you go to a clinic, you are not even sure whether they are licensed or they are properly, controlled, regulated to offer healthcare to people. So through unsafe injection or blood transfusion that has not been screened properly, people can actually get tested. So like Bisola said in her introduction, it's not just about I'm a virgin. It's not about I don't have multiple sex partners. It's about your hygiene and taking care of yourself, your barbing tools, your manicure, pedicure issues. You have to take care of that, because once it's through the blood, it can be transmitted. The another one I want to mention is mother-to-child transmission. Like syphilis can be transmitted to the child, and the child can be born blind. It's as bad as that. So it has to be treated, and that's why we encourage women to do early antenatal care, so that they will do all these basic laboratory investigations, and if there are infections, it will be properly treated. Nobody wants to give birth to a child that's blind. That would be a big challenge for the family. So these are some of the things we look at. And then multiple partners, like and in contemporary time, you have people having tattoos in their bodies, marks, tribal marks. All these things are ways whereby there could be contact with infections that are really sexually transmitted. That's another way, apart from having sex itself. So it can actually be transmitted through the blood. So just like I said, proper investigation. If you notice anything unusual on you, please get to the health facility and be properly tested. And another thing is, don't be shy, because some people, they will hide it, and before they know, a lot of damage has been done. So we have to ensure that we report any unusual itching, pain, or if there is a kind of exposure and you are not sure, it's better to check it out. So we encourage testing, regular testing, and then if there's anything, talk to your partner if you are married or whoever, or go to the health facility and complain, because by the time you cover it up, the damage will be more. And there are some, like that of human papilloma virus, which actually was implicated many years ago to cause cancer of the cervix. We need to be vaccinated. There was a time it was all over the place that female children, the teenagers, I think around age 15, they should go for vaccination. So all this will actually help to prevent this HPV. It can be prevented by vaccination. And then we encourage monogamy as much as possible if there's no religious implication. That will be help a lot, and a lot of safe practices. Practice safe sex. And if you feel you are not married, you don't want it, you zip up and keep yourself, and then observe personal hygiene. And that will be very, very important. For teenagers that are menstruating, we encourage them to really observe personal hygiene. That will be helpful, because when the blood is infected, actually, you can reinfect yourself. Even after treatment, you can reinfect yourself for things like chlamydia, even some bacterial infection, when the proper hygiene is not put in place. So these are some of the things implicated in sexually transmitted disease. And then from studies, we notice that it's becoming very rampant now because of the way people actually the myths around sexually transmitted diseases. Now, I will say this: we had a scenario of a young man about getting married. Just few days to his marriage, they didn't do the test early enough, because you are supposed to do some of these basic tests before marriage. That's what we encourage. So they didn't do the test early enough. So few days to their wedding, after they paid the dowry and all that, they now noticed that the girl was HIV positive. As I tell you, the marriage did not take place. This is something that will affect both families. They're depressed, they're very unhappy. So what we are trying to say is that for intending couples, we encourage them to do basic tests of other things apart from the STDs, even the genotype. All this thing goes together. Syphilis, very, very important, because if it's there, it can be treated. And one should not victimize or discriminate against anybody with STDs. And that's why we have our counselors in our health facilities that will handle this in confidentiality. So you don't need to be ashamed and die in silence. It's better to speak out and get yourself treated, and you can check and check again. And once in a while, if you are not sure, you go for retesting, and that will be nice. Then communication between couples, if you notice anything, because it might not be from you, it might be from your partner. Maybe travel to the hotel, a particular hotel out of town, and the one is not careful. And that's why we should be careful when we are not using our own toilets. One can actually pick it, because some of these pus from discharges can drop on the toilet, and you just come in and sit on the toilet seat. It can be contacted like that. It's as simple as that. So one has to be careful. And hand washing, very, very important. You need to wash your hands because in fact, infection control experts they always advise that we wash our hands often. You go out of your house, you wash them, because they are in your hands. You can't underestimate the kind of infection your hand can carry. And that's what we used to eat. We just pick fruit, granite, we pick and eat. This thing can actually affect us. So this is just about STDs, and there are things that could be treated. Even for HIV, the most dreaded HIV, people are living their life with HIV and they are okay. So we should not victimize people. Maybe the child picked it for a parent, or just from tattoo, or from maybe injection which is not supposed to be in a good health facility. So there should be no victimization. There should be no shame. Once you notice it's about your health, it's about your life, and it has to be treated perfectly for people to enjoy their life, their quality of life, and be comfortable in society.
All right, thank you so much, Dr. Mabailala, for the brief intro. And thank you. Welcome to our viewers for joining us once more. For those that are just joining us, the topic of our Q&A today is sexually transmitted diseases. And like we said earlier, what you know can actually hurt you. So because you think you're a virgin, or because you think you have just a sexual partner, doesn't mean you cannot still contact these sexually transmitted diseases. So the Q&A for today is brought to us by Complete Care. Complete Care is a digital health marketplace that connects patients with healthcare professionals in the shortest period of time. And okay, so we'll be proceeding now. So for now, we will take some questions that were sent in to us before the session. So one of the questions that was sent in is that, okay, this is from someone asking, why does it keep it keep reoccurring even after getting medications or after using drugs?
Okay. Reoccurrence, I mentioned it in the introduction. It's very possible. That's why once you are treated, ensure that you are properly treated. Not just using herbs, not just going to a chemist and getting incomplete dose of antibiotics. And if it's a viral type, it will never be treated with antibiotics. It has to be antiretroviral. So that's the issue. So the ideal is to visit the health facility, give the complaint. Don't diagnose yourself because you are not the medical expert. Then the diagnosis will be made through investigation, thorough investigations, and thereafter there will be prescription. And once you have this prescription, you ensure that you take it as it is prescribed. Not that, oh, after 2 days I'm better and you stop taking the medication. You have to complete the dose for effective therapy. And there should be a follow-up thereafter. If you miss out from follow-up, there might be reoccurrence. If you expose yourself again to the same infection, or maybe not washing your hands and all those things we have mentioned, there could be reoccurrence. So it has to be properly investigated and treated, and a follow-up is very important.
All right, thank you, Ma. So before we proceed, please, viewers, you can drop your questions in the chat button as chat function as well. So we'll proceed with the questions that were sent in before we go on to the questions dropped by viewers. So another question here is that what are the types of
Okay. Like I said during the introduction, we have gonorrhea. Gonorrhea is bacterial in origin. And most of the time, the female observe it first. Female might not even have any symptom, but then it's doing its damage. That's the truth. So men usually feel it first. That's gonorrhea. It's called by a kind of bacteria. We call it Neisseria gonorrhea. That's the bacteria. Then we have chlamydia. Chlamydia is bacterial in origin as well. And most time, women don't have symptoms early, the same way. And then we have syphilis. That's the one that said the effect on the unborn child. That's peculiar about syphilis. And most of the time, you have all this discharge, difficulty urinating. That's syphilis. Then we have apes. At times, we call it caused by the apes simplex microorganism. This is another type, but it's viral. It's not all of them that is bacterial. We still have some that are viral, like the apes infection. Most of the time, you have sores or blister. It will just come up and it will open up. You will think it's just one small thing. It will appear maybe on the penis, or at times on any part of the reproductive external reproductive organ. So this is peculiar with apes, and at times it goes to the angle of the mouth to at least to manifest in a way. So that is AIDS. Then we have this human papilloma virus, which is viral in nature, and we are giving immunization against it using the HPV vaccine that we give to younger girls to prevent cervical cancer because it's implicated. So these are the common ones that we have, and you can never tell which one it is until you complain and investigation is done. There are a gold standard of investigation for each of these. Once you give the complaint, the physician will know what investigation you should have, and then it will be properly treated. So these are the common ones.
All right, thank you, Ma. So I think we'll pick a question from that was sent in, one question, then one question from the chat box as well. So we have one of our viewers asking us the question that, please, what are the basic tests before getting married? What tests should be carried out on couples before they get married?
Okay, that's a very good question because prevention is still better than cure. And we always know that prevention is cheaper. Like the scenario I printed to you, though they prevented late, but it's still better at that stage that they did the HIV test towards very few, like 3-4 days to their wedding, and they've given out the cards. The wedding did not hold as I speak. So you can see such things can cause depression, anxiety for both families and the intending couple. So the basic test we usually advocate is genotype, very, very important. If you see what sickle cell disease is doing to children, I've seen a colleague of mine, I don't know what happened, long ago when I was in school, though a very senior colleague. She had 4 of them, and she lost 4 of them to sickle cell disease. Yes, I know things can really happen, but sickle cell is not a joke because they have a lot of risk. Once it's cold, there's a problem. When they have malaria, it's terrible on them. And the vaso-occlusion issue is a problem. Some can even end up with stroke, even from sickle cell. So it's better not to have a child. You cannot go to work. You'll be spending money, and the 2 of you will not even enjoy the marriage. It's better to test genotype. If you are AS and AS, you cannot marry. AS can only marry AA. But we've seen AA that married SS. Maybe the person just felt, okay, I want to risk it. At least the children will be AS. So it depends. And I've seen one that had another brand of sickle cell, which we call thalassemia, SC. We call them SC. I think the husband was AA before she passed on. She had 5 boys. But during pregnancies, when they have problems, apart from that, you will not know when they are well fed and they are well taken care of. So it's a lot taking care of a sickle cell child. So it's better to do the genotype. Then the blood group is another very important thing. Some few women are rhesus negative. That's why you see few women, they'll just have only 1 child. After then, they may not have. It's not every case anyway, but it's a common sight in the society. Just 1 child, then the person will be aborting and aborting. It could be rhesus negative. For rhesus negative women, they need to take what we call antiglobulin. When they go to antenatal care, it will be detected because these are basic tests that will be run. And the person will know that is a rhesus negative. So rhesus negative people don't take rhesus positive blood. You might be the same blood group, but you cannot take positive blood. So, for example, if you don't know, let's say there was no screening and you give, that person might have problem with the body system. There will be antibody reaction and it can be fatal. So these investigations are very important. Then we are talking of STD now. It's good to check your HIV status before marriage. I know of couples that will still go ahead with their antiretroviral, but they know, and they know what to do to take care of themselves. And I've seen people that got married to themselves, they are both positive because there are things to do to protect the unborn child, which the health facility will take care of. So it's not your decision to say, okay, I want to still go into the relationship, but it's good to know your HIV status, your blood group, your genotype, and other important things. Like this syphilis test is very important because of the effect on the unborn child. And all others is very good. Even if you have itching, don't just go and get medication. By the time you repeat medication over and over, you find out that you might have resistance because you are not treating it with the proper drug. That's why it's good to consult the physician and get the proper medication for the exact type of infection. So that's what I will say for now. Hello.
Oh, so sorry. So sorry about that. My mic was muted. So be moving on to another question here that
Okay.
says, okay, so that is toilet disease and STD. So it's everywhere, toilet disease, toilet disease. So it's toilet disease and STD.
Okay. In our community, you hear those that sell their the open drug market. They are not pharmacists, they are not physicians, they just go with their vehicle. You hear them say toilet disease, toilet disease.
Mhm.
And at times you just hear that talk, gonococcus, gonorrhea. When I hear that, I'll just laugh because it's like they don't understand how it works. And they want to use one medication to treat every disease. That's a bit funny. But the truth of the matter is, in our society, I think we call them toilet disease. Anything that makes you to have unusual discharge, painful urination, painful sex, you are seeing sores around you. I think they just call it toilet disease. So, but the right word is sexually transmitted disease. And it can be actually gonorrhea, it could be syphilis, it could be other types that we have mentioned before. So people call it toilet disease.
Or
I know they do. Yes. Thank you, CC Queen.
all right, thank you, Ma. Okay, so we have another question here. What? Yes. Yeah. Yeah, all right. So moving on, we have another question here that says, what is the prevalence of sexually transmitted diseases in Nigeria? With increased awareness, is the prevalence of sexually diseases receding or increasing?
Okay. Prevalence is a big word in a country like ours that we don't really keep records, and people are quiet. They want to keep everything secret. So we are talking of the ones that we come to the health facility. That's the only record we will have, maybe in a particular hospital. We don't have a centralized data, system that will show the exact the prevalence. But I know from studies, it's like even with the awareness, people are still having been keeping things secret. I don't want them to know I have toilet disease. I don't want to know I have this. Oh, even to come and access care, they don't want to come until the damage has been done. Madam, have you ever had infection? Say, one time I used to have it, you go and come back, and they'll keep it to themselves. So we cannot actually pin it down to a particular figure, but for institutional records, we can have it that awareness, and maybe for people that will come to the hospital, the awareness might be better. But our people in the rural area that don't even visit the hospital proper, they they want to treat themselves with herbs and all that. So that's making it difficult to know. But from my experience, as I work with maybe clinics over the years, my experience, I noticed that people don't want to speak out. Even married people, the husband wants to hide from the wife wants to hide from the husband. So you need a lot of counseling and trying to discuss it for people to actually come out of their shelf to discuss STD. But it's very important because the complication is enormous. The young one with this infection over time, we keep it, and before you know, there's issue of infertility, scarring from infection, inflammation, even pelvic inflammatory disease is one of it. Just pain down there, terrible things. And once this thing passes, they keep on using drug. The effect of drug, overuse of medication, or irrational use of drug, or abuse is now another problem. So it's a compound problem, and we need to nip it in the bud by creating awareness, educating our children, our teenagers on the importance of hygiene and all this personal hygiene, the home hygiene, the environment, very, very important. Even the way we dispose our waste, it's very important. So that's what I will say about prevalence. We don't actually have a centralized data system in Nigeria.
All right, thank you so much for that. I'm sure the viewer that dropped, and for us, we've all learned that as well. So moving on, the next question here is, how are STDs transmitted?
Okay. Thank you, Chidi Tochukwu. We appreciate that. STD, there must be, infection generally, there must be a portal of entry to the body. And that's why I was talking about tattoo on steroid needle, maybe pus on a toilet that you didn't notice, or somebody just used the toilet and it's just kept anyhow, and you just come in and you visited the same toilet. You can just pick it from there. You are not aware. Care of your undies, your boxers, and all that, very, very personal hygiene. Your toothbrush should not be shared. Needle should not be shared. And the delivery should be, you should have your delivery in a safe environment, not just one local hospital that has no aseptic technique in place. Anywhere you're having your wound dress, should be the instrument should be sterilized. Your blood transfusion should be done safely after screening. So these are portal of entry, apart from sexual intercourse. People that like to tattoo their bodies, they want to share everything. It's very unsafe. Barbing tools, pedicure, I mentioned that before. So once there's a portal of entry, the body will make effort to resist that, there's a foreign body here. Something is here that doesn't have to be here. Before you know, the body will respond by being, there's what we call inflammatory process. Along the line, the individual will begin to feel feverish, all those signs. There's something wrong with me. I'm not, maybe it's malaria. You just go and buy anti-malaria, which most people do. But you won't know it's infection until maybe for the male, they start having pus coming out of their penis. They want to urinate, is a problem. There's pain, or they're having sex, they're having pain. Then they'll know that's real infection. It has entered the body and it has taken position. So the best thing is, if you have unprotected sex, it's better to report it. If you have needle pricks, this is common with health practitioner anyway, or anybody, maybe saloonist, you have needle prick, you have to go out for what we call pre-prophylaxis. Then the one that is after is called post-prophylaxis. So all these are very important. It's not just going to one shop and buy Bicham and Ampiclos and Nicocin, like I said, and to feel you are covered. The infection might just be there building up. And before you know, you become sick. You are not yourself, you are tired. You cannot eat well, you lose appetite. All these signs will come, and you begin to see signs of pain in the abdominal region, that's pelvic region down there, especially for women. Then you begin to see all this discharge. It can even have, the odor might even change. You will notice that, this odor is not correct. At times it changes color. So these are just the way, and then you need to take care of it. So there's a portal of entry, and that's why we want to prevent infection from entering our bodies, so that the body will not have to fight for anything, and then we don't have to come and spend so well to treat or have complications from these damages.
All right. Thank you for that, Ma. So, like you mentioned few minutes ago, like you mentioned, some people would feel somehow they have cold or pause. What are the symptoms once you see this, or once you're experiencing this, or once you feel like this? Then you should, be at alert to go for a test and get diagnosed.
Okay. Generally, you feel unwell. We call it general malaise. You just feel unwell, as what's wrong with me? But the more cardinal sign will be that you're having itching. Don't ignore it. The next one, you're having an unusual discharge. There's a normal vaginal discharge, especially for the women, and even the man, that something is abnormal. Once you notice abnormal, unusual discharge, you should report it. Or you are having painful urination, as in you are urinating, it's so painful, it's burning you, and this is not a good sign. Another one, you notice sore on your private organ, that's your reproductive system, the external genitalia. You notice sore or blisters. At times it will appear and reappear, and it's just coming and you don't understand. You need to report it. And at times you see rashes. This is another sign. Or pain down there, very painful, maybe radiating to the back. You need to report it.
Thank you for that, Ma. So moving on to her next question here. How can STDs be prevented? How can we prevent these sexually transmitted diseases?
When we're talking of prevention, honestly, we advocate for a kind of periodic check. On your own, it's good to do medical check periodically, and that means you are proactive about your health, which most people don't do. One needs to be proactive. If you notice, okay, you went to a place, you're not too sure, why not check? Don't just wait, then you'll be doing well. You can be giving what we call preventive therapy. Then another important way to prevent is practicing safe sex. Faithfulness to your partner is very, very key, especially in a monogamous setting. But for the polygamous setting, maybe because of their religion, we will not be able to control that. But then, if everyone is doing what they're supposed to do, at least they can control they can control to the point that STDs will not come in, because once one of the partner is infected, all others stand the risk of being infected in a polygamous setting. Then we want to advocate for that one should prevent unprotected sex. You just meet somebody, you don't even know anything about the person. It's a very risky behavior, high risk behavior indeed. So we want to say no to that. Then for those that believe in use of condom, yes, but it's not absolute. Use of condom will not prevent STD absolutely. You know, we have different brand of condom. Some are too light, that could be exposure and the person will not know. So condom is not absolute in the prevention of STDs. So we have to get us, but it can prevent it to some extent. Then we want to talk of we want to discourage multiple partners. Yes, because the risk is higher with that. Then prevention can be by vaccination, like that HPV I told you of is a very good way. We can do prevention. Then communication among partners. If you notice anything, treat yourself, involve your partner so that you don't infect your partner and get reinfected yourself. So it's good to communicate and do regular testing, and also do what we call reproductive health education for our youth and our teenagers, especially our girl child. We need to really educate them how to take care of their personal hygiene during menstruation. Our toilets should be clean. We should wash our hands. Even fruits that we eat our hands should be washed. Our fruit, because of this, especially the hepatitis that can actually be transmitted through that means. It can be fecal oral, it could be through needles. People that share needles, we discourage that. So these are basically ways of preventing STDs. Then you can eat good meal, eat good balanced diet, and make sure your immunity is good. But that's just an addition.
All right. Thank you so much, Dr. Mopilola. Thank you to our viewers. Thank you for joining and being with us for this session so far. So once again, just to let our viewers know, this Q&A session was brought to us by Complete Care. Complete Care is a digital health marketplace that connects patients with healthcare professionals in the shortest period of time. So this is a monthly Q&A session where we bring topics that we know that people need to be educated on. We know that so many people need awareness on so many health concerns and health topics as well. So this is a monthly Q&A session, and would be informing you about our next session immediately after this. So now, before we proceed as well, we have a giveaway which has been included during the course of so to tell the people to drop our questions. We had trivias that were sent out, and we had people who dropped comments, and would be announcing the winner. And for us, Dr. Mopilola will be announcing the winner of the trivia questions before the end of this session. So we'll proceed. So please stay with us. Don't leave. If you know you answered questions during the trivia, or you answered questions for the trivia, please don't leave. Stay with us till the end of the session so we can announce our winner, and winner can get the prize. So thank you. So we'll be moving on now. So there's a question here that says, can all STDs be treated? Are they all treated, or there are some that cannot be treated?
Basically, once the diagnosis has been made, STD can be treated. Because I told you that some are bacterial in origin, some are caused by virus, and others are caused by parasites. But in any way, proper treatment is very important for all these STDs. But we have to try to prevent reoccurrence, which is very important. I talked about proper lab investigation, use of your medication as prescribed, and make sure you finish the dosage and then do a follow-up. Very, very critical. Then for HIV, which is a viral infection, you might not have absolute cure, but the quality of life of the individual will be ensured, because you have to be on medication it's a lifelong thing. They have to be on medication. But then people are living with HIV and they are keeping their families and their children are healthy, even negative, not having HIV because of the recent trend in HIV treatment. So it's treatable and quality of life can be assured and it's not a death sentence. So one should be able to come out of his shell, discuss it with the health practitioner and get treatment and enjoy life.
Thank you for that, Ma. So without wasting time, moving on to our next questions here that said, can STDs affect fertility?
Yes. For infection to go into the reproductive system, STD can actually cause infertility because there will be infection. That's a kind of inflammatory process. And once there's healing of that inflamed aspect of the body, there will be scarring. So once you have a scar, let's say along the fallopian tube, it causes blockage. So the person might not be able to get pregnant, or is getting pregnant and because of the blockage, the fertilized ovum cannot move to the uterus to be embedded. Then it will have miscarriage. So all these things can happen with STD, and that's why we want to be sure that we don't expose the individual to infertility. In fact, that's the commonest complication. So for both male and female, it has to be properly treated to prevent this complication of infertility, either with bacterial antibiotics or antiviral drugs. Very, very important.
Okay. Thank you for that, Ma. Can STD be contacted through or transmitted through oral sex?
Yes. For those that do oral sex, I actually mentioned about anal sex, oral sex, vaginal sex, because that's the one that people do that, though the most common is vaginal sex. Once there is a contact with the infected blood of the individual with STD, the partner can contact it. And the mouth is not an exception because the layer in the mouth, we call it the mucosa, that's the mucous lining, is as light as, it's very light. You can see it within your mouth, you can touch it. It's very light. Once you have a wound there and there's contact, blood to blood contact, there could be transmission. So whether anal or oral or vaginal sex, there could be transmission of STDs, especially herpes simplex that will even show in the angle of the mouth. It's a viral infection, can be transmitted.
Okay, all right. So just like you just mentioned now, Ma, you mentioned apes sickness that that shows at the corner of the mouth. But we know
Yes.
here in this part of the world, I would say yes, in this part of the world, this country, once there's something at the side of your mouth, they tell you it's fever. They tell you it's malaria. Like it's a common thing that people
Okay.
say that, oh, this is malaria, this is fever. So I think this is actually an eye opening as well. So you don't have that in your mouth, or you see something and you're saying, oh, it's malaria, you go get anti-malaria. So I think this is an eye opening and also an awareness for people to know that you should get tested. Not
I
everything
think
that
I
you
still
see at
want
the
to
side of your mouth.
explain further.
Yes, please, you can do that.
Yes, let me explain further.
Yes, please, you can do that.
If you have fever at
Yes.
times, it could do that. We call that one angular stomatitis. That one is a bit different. But this herpes simplex will be there. It will go, it will come back. It will go and come back. Once you notice it, you need to check. You need to test yourself. For that of the fever, yes, we can have that because of fever, but it's not all of them. You will notice recurrence, and the thing is just we inside the mouth coming, and it will even go inside the mouth and the side of the mouth. So it's different from the one you are talking about. But then if you notice anything there,
Okay.
especially for people that do oral sex, they are prone to that. That's a kind of risk that they are exposed to.
Okay. So it basically just means once you see that, you should try to get tested to know exactly which one it is, if it's
Yes.
fever or herpes. So please, viewers, Once you notice anything, go to the nearest hospital or the hospital you use, or you can even consult with a doctor on Complete Care, www.completecare.com. We have doctors readily available for instant consultation or scheduled consultation to attend to you as well if you notice any changes at all in your body and you need to speak to a doctor. So moving on right now, the question that asks now is, how often should we get tested for STD? Like for someone that is sexually active, how often should they get tested for STDs?
Okay. Well, usually we say, okay, annual checkup. That's just basic. It's good to do what we call annual checkup. But when you know that you have traveled to a place and you're not too sure, maybe the place, and there was a contact with somebody you don't know, that's another risk factor. So it depends on the individual. If you are exposed, or you are not too sure, like I said, if you travel to a place, maybe you are not too sure there are toilets and all that. That's why some people travel and go with maybe hypo and make sure they take care of their toilets, even hotel toilets themselves before they
Yeah.
use it. Very, very important, because you can just pick something before you know you are itching, before you know you're having discharge and having pelvic inflammation, which is very, very painful. So periodically, annually, you can do that. But when there's exposure, it's advised that you do what we call prophylactic, preventive. Just go and check up. And if there's anything, it should be treated on time. And early prevention, detection is better for you to prevent those complications we have highlighted.
Okay. All right. So the question here now is that, is there a difference between STI, sexually transmitted infections, and STD, sexually transmitted diseases? Is there a difference
Okay.
between the two, or they both are the same?
Okay. For STI, we say they are sexually transmitted infections. So the other one is sexually transmitted diseases. They are actually the same thing. It's just nomenclature. They are the same. And it's a group of diseases, like I said, there's bacterial origin, there's viral origin, there's parasitic origin. So at times it might not even be bacteria. It might be something that you need to, is from parasites. So you need to check to know which one it is. But at times they mimic one another in their presentation. Their signs and symptoms might be similar, but there are unique ones for some, like gonorrhea, and there are unique things about them, and then you test for that to really know. So they are the same. It's just the nomenclature.
Okay, all right. So we are rounding up the session. So the question here is that, are there foods, while you're using your medications, are there foods that help you heal faster, or are there actually foods that can prevent you from improve your symptoms, help improve your healing as well, or that can actually prevent these infections?
Okay. Generally for infections, including STDs, it's good that while you're on treatment, you should eat balanced diet. I mentioned it earlier. Food classes, carbohydrates, fruits. You have to increase your fruit intake, because things like vitamin C will aid healing, and you have to take protein so that you recover, because you can see all those signs of tiredness, fatigue, feeling feverish. So you need to eat very well to recover and then to aid healing. So it's very important to eat well, to eat plenty of fruits, increase your vitamin intake, so that as you are taking your medication, your body is recovering and you are doing the needful to prevent reoccurrence.
All right, thank you, Ma. So now I know to the time that some of our viewers have been waiting for before we eventually round up the session. Would like to, so we have so we had trivias that were put out to ask questions. So We have about 60 comments in total without repeating of names. So we'll be sharing my screen. I would be sharing my screen right now so that we can all see it and we can be transparent. And Dr. Mopilola will be picking a number randomly. The number and the with the each number have the username of those that dropped comments, and the number that she picks will be our winner for the trivia. So I'll proceed now to share my screen so we can see the list that we have and we can get to pick our winner. So we do hope that the winner that is picked is here on the live session. If not, please, if your name is called or your number is picked and I call out your username, please drop a comment that you're here. If not, we'll next Dr. Mawilala will have to pick another number randomly for us to select a winner. Thank you. So I'll be sharing my screen right now. Please, doctor, please let me know once you can see my screen.
All right. Okay.
Can you see my screen, ma?
Yeah, slightly bold. Make it bolder.
Oh, is this okay, ma?
Okay, this is fair enough.
Okay.
Okay.
All right. Going through.
Yes.
So in total, let me just go to the end of this. In total, we have
Yes.
67 um names here, usernames here. So I'm just going to scroll from up here
Yes.
slowly.
Okay. I have Nemi, number 30. Nemi.
Number number 30. So that is
Yes.
Nemi. So please, Nemi, do we have any viewer here with the name Nemi? Nemi. Nemi. Please, are you here? Nemi, if you're here, please, we would confirm that with your username. So please, if you are here, you drop a comment that you're here with us. Nemi. Nemi, are you here with us, please? If not, we'll move on to another um, username. I don't think we have anyone with the name Nemi here, so I think we'll just move on to another username. Another username. Okay, so should I start scrolling all over again?
Okay, let's go to 41. Clara Ladi Beats. Clara Ladi Beats. 41. Forty-one.
41 Clara Ladi
Yes.
Beats with the
Yes.
username Hello. Okay, so that we don't delay any further, I think the first two usernames we've called, I don't think they are in this live session. So we have some usernames that are on this list, and at the same time, they've joined this session from the beginning of the session, and they are still with us
Okay.
up till now.
Yes.
So I'm going
Okay.
to call their names out. So we have Nemi. we can just randomly pick from. So we have a
All
username
right.
here,
Okay.
Asanwa1. So there's one Asanwa1. There's Lucky Jack. So we have Lucky Jack at number 48. So I'm going to pick their number Asanwa one. So I get to check Asanwa one for number 24. Um, we have Ima Obis as well. I think let me check if Ima Obis is on. Yes, Ima Obis is on our list as number 28 as well. We have Henry Knight Fire here on the live session and also on our list as number 32. And also, okay, that is that for her viewers right on our Instagram that are on our list. So I'd proceed to see those right here. Elom,
Okay.
we have Ayodeji. Let me confirm Ayodeji's number. Your DG's number. So you can just pick. So I'm going to call out the number, ma. Then you get to pick randomly from that number, ma.
Okay.
So we
Let's
don't
go for
further waste
Henry.
of time. So your
32.
DG's number.
Henry, 32. Henry, number 32.
Number 32, Henry Nightfire. Oh, okay. So please, Henry Nightfire, are you here with us? Drop a comment. Oh, yes, Henry is here with us. He
That's
just
good.
dropped a comment on our Instagram page. So Mr. Henry Nightfire, so yes, you are winner for our trivia. We would reach out to you and also make sure you get your cash prize included in the trivia. So yes, we can see Mr. Henry is signaling that he's present is watching on our Instagram page. So thank you so much to everyone that dropped a comment and answered as well during our trivia. So please, another same time next month, the every last Saturday of the month is when we Q&A takes place. And also for next month, we'll be having another trivia, and I'm sure someone else will be winning this cash prize. So before we round up the session totally, please, Dr. Mopilala, can you please give us an advice, just general advice to every one of us as well on how to prevent ourselves, how to take care of ourselves, to prevent yourselves from this prevention from these STD diseases, and also how to live a very much better life. Thank you.
For Thank you very much. For STDs, we still say prevention is better than cure because by the time you're infected, you spend a lot of money, and we know the present economic situation. We still say prevention is better than cure. So very, very important. We have to take care of our personal hygiene. Our toilets must be adequate. Even if we have multiple users, we can still be hygienic. Our environment, how we dispose our waste, very important. Washing our hands cannot be overemphasized. Very, very important because some of these can be infected, the infection can actually be contacted through blood, and others can be contacted through sharing with utensils, equipment, all sorts with people. So it's good that we monitor all these areas and make sure we eat very well. And when you have any complaint or you observe any changes in your body, please report it to the nearest health facility and get properly treated. Self-medication is a no-no. And by the time you self-medicate, you stand the risk of reoccurrence and you are not properly treated. And issues like infertility, complications, PID, that's pelvic inflammatory disease, can occur. And it can be embarrassing. So it's better to take care of your health, enjoy your life, your quality of life, be able to go to your work, be able to do your academic work, and be able to enjoy good health. So it's very, very important to prevent STD in our day-to-day life. Thank you all.
All right, thank you so much. Thank you everyone for joining. And Thank you so much, everyone, for joining our session for today. See you same time next month, last Saturday of the month. Sorry, over 67 people that dropped comments as well. And for this session, we are streaming this session on multiple platforms. As we are streaming on Facebook, we are streaming on Instagram, and we're streaming on YouTube at the same time. And we all have a list compiled, which Dr. Mipulala picked a winner randomly. We have people that joined the session all from the beginning. So see you same time next month. Have a good evening and enjoy the rest of your weekend. Bye, everyone.